Hey, how are you?
Fine.
I remember briefly from our last meeting, you spoke on symptoms of OCD, but we didn't get into specifics of exactly what it is that you think is going on. So just share with me your symptoms and what things you find yourself constantly doing.
I'm doing laundry. I find myself separating my socks left and right. Like, they have to be left and right or I'll go crazy. Like, and then if they're not and I can't find a sock to match, I'll stop what I'm doing and look for it and then match all my socks up left and right. And if I'm in a place and it's not clean up to my part and straight, I'll clean that place up just so I'll feel more comfortable in that place.
So you're saying it's not just limited to your home.
No.
So give me an example of where you've been somewhere and you felt like it wasn't up to standards, or where you felt it was comfortable for you.
The workplace where I work, the stock room, when I'm not there, is usually messed up and dirty, and I have to clean the whole stock room before I even start doing anything. Like, it has to be, like, things have to be in an order, in a straight place, and everything has to be in the right place before I even get started doing what I'm doing.
About how much time does that take up? Say you have a certain task you need to be done. Do you find yourself focusing on arranging and organizing longer than you should before even completing the task that you were asked to do?
Not that, it's just, it has to be straight and clean up to until I feel comfortable enough to start what I need to do.
Okay. Also, I know last time we talked about the OCD self-test, where you would check off everyday situations that you deal with, and then you look at which particular experiences causes any distress or bother you the most. And you did it for that month. Did you see anything in particular that was ranked higher than something else? Like, what did you see that bothered you the most while doing that test?
Being in clean places, because cleanliness is next to godliness, but I know some people aren't as clean or as organized as me. So I find myself like straightening up different things and doing different things so I can feel more comfortable in that place.
So do you feel like whatever that is, when you say you feel like you're going crazy, what do you mean by crazy? Like, what is something that makes you feel that way? That's not up to your standards.
Being in maybe someone's room, if I'm over a friend's house and being in their room and there's stuff thrown everywhere, I wouldn't feel comfortable enough to like actually sit down and have a conversation with that person until that place is straightened up or clean enough for me to like relax.
So you feel, I guess, uncomfortable being in a situation like it can't be handled. You can't handle a conversation or do anything until that's straight.
Done.
Mm-hmm. Okay. Also, you said you did the self-test, and I was looking to, support groups, or even our next visit. Your homework could be, just write down any obsessive thoughts or worries, and you keep track of that. In addition to, meeting with me, or also would you be interested in any support groups? Like, they offer groups of people who are dealing with OCD, and not limited to how severe or how minor it might be. So yours would be, they're arranging an organization. You might have those who, washing hands, constantly repeating certain rituals throughout the day that might take up time. Will that be something you're comfortable in doing?
Yeah.
And also, staying connected to family or friends. Do you have any friends or family members that you discuss this with, or who know that you're going through this?
No, not really. It's just some people that I'm close to do notice it more often than not when I am around them, but I never really talk to them about it.
Do you feel that those people that you are around most would judge you for it, or would you be comfortable with being open about it?
I don't think they'll judge me about it because I don't think like it's an outrageous thing to be clean and be comfortable in a clean place.
Mm-hmm.
But they just think they'll probably think like that I'm obsessing over something sometimes that I can't control, like being in different places and it's dirty or not up to my part of cleanliness.
Okay, so you do say that's something you're willing to do, maybe talk about it or just let them know. Because even though it's not, you say a big deal, if you let people know, then maybe they'll, cut back on what it is. Say if you go to someone's house who might not be clean, knowing that you deal with that, they might, change the way they do certain things. Of course, it doesn't happen overnight, but, that's a suggestion. In addition to sessions, meeting with me or another counselor. And then there are also myths to OCD. Do you remember where it may have began? Like some people think it starts from childhood, but in reality, it can just happen out of nowhere. Do you remember the first time?
Maybe when I was like preteen or teenager, like just always wanting things in a certain place and being clean, because growing up my house was never dirty and stuff, so when I go to other places, when I started like looking around and stuff, like I just always wanted to be clean so I could feel comfortable to actually be in that place. I think it started like that as like I started getting older, like as maybe 11, 12.
I also would like to recommend, in addition with the writing down your certain thoughts, or even a support group, there's an OCD scale, the Yale Brown OCD scale, where you rate the severity of using a checklist. So say you find yourself spending so much time, looking for a certain sock, the left and the right, and if it's not the same, it might take up your time. You would rate that on a scale from like 1 to 5 of how severe it may be. Would that be something you think you could do? And then, you monitor it to see any changes when you do that.
Yeah.
And also, cognitive behavioral therapy is known to be most effective, and it requires a specialized protocol called exposure and ritual prevention. So for instance, you'll be put in a situation where you'll be exposed to something you're constantly doing, but you have to prevent yourself from doing it. So say if you were somewhere messy, you couldn't just stop and clean it up. Could that be something you're open to?
Yeah, I would have to try and prepare myself for it, but
yeah, again, like it's not overnight, so it's something you would keep doing until you see that it's getting better. And also looking into other psychiatrists. I looked into Jeffrey Schwartz, and he came up with certain things people look at. So that's dealing with OCD. And one of them was relabel. So you recognize that the certain thoughts, the obsessive thoughts, are a result of your OCD and not you. So don't feel like you have to place blame on yourself or feel guilty. Also, reattribute, realize the intensity of the thought or urge is caused by the OCD. So, how you might feel like it's a big deal to clean up a certain thing or have it a certain way, just know it's not you, it's your OCD. And refocus, work around those OCD thoughts. Like, what is something you do, say, to kind of keep you from focusing on being organized, being clean in a certain place, especially in a situation where you might not be able to do it.
I try to think about other things to take my mind off of it. I try my hardest because, like, I know some things, like, it's out of my control and it's not my place to do certain things for certain people and to, like, straighten up their things because it's not mine. But I'm trying.
And also, the last thing you mentioned was, don't take the OCD at face value. So if you feel yourself getting discouraged, like you're upset because you see yourself doing it again, just remind yourself that it's just your OCD. So it won't be a bigger deal than what you think it is. And also put your focus on something else, like exercising, maybe working out, eating healthy, are also other alternatives to focus on something else to keep you from doing something compulsively or doing it, repetitive and take up most of your day. But do you have anything else you want to share with me concerning your OCD?
When it comes to my socks, I don't like dirty socks either. Like, I always walk around with shoes on. Like, dirty socks kill me. Like, that's one thing that I will not tolerate.
So the level of intensity, say with cleaning, you said you want things a certain way. What is your level of clean and that's it? Like, you felt like it's done.
When I can walk around and look at things and there's no dust, everything's in a certain place where it's supposed to be, and I can sit down and actually be comfortable and not even worry about anything. That's when I feel like it's okay.
Okay. Well, like I, recommended, you said you are open to the OCD support group. And then our next meeting, just make sure, you write down anything that your obsessive thoughts or worries. You do that as your homework. And even when we don't meet, that could be something you continue to do to keep you from doing something over and continuously. Also, I will take down what we discussed today. Of course, it's confidential. And then you just follow up with me with our next meeting. And we can meet again next week. And you're still free to do 2 times a week. Is that still convenient for you?
Yes.
All right, so we'll follow up with our next session. And you tell me if you have any changes or anything that you want to see changed. And we'll follow up then.
Okay.
All right, thank you for coming to see me, and I'll see you next